Let me share my plan with you so you know what to expect. There are two topics that we'll be talking about today. It will be about two emotion-focused techniques. Emotion-focused techniques that I've come to learn about in doing schema therapy. But these techniques are also doable as standalone therapies, especially the imagery rescripting. Chair work normally is still part of a larger treatment plan, but these are techniques that are not solely limited to schema therapy. These are powerful emotion-focused techniques, not developed by schema therapy, not at all. I mean, imagery rescripting was done 100 years ago, but schema therapy has been a huge boost to development and the knowledge about imagery rescripting. So two techniques that I would like to introduce, also would like to demonstrate, like role plays, as Patricia mentioned, but also share some clips with you. And I was deliberately specifically asked to reserve enough time for questions and answers. I already received a couple of very good questions, so I'd love to talk about the different questions you might have. Feel free to ask, because I like to make this a pleasurable learning experience for you. It's not just a Saturday for me, but also for you. So let's make it a good experience. Okay, that's my plan. And as you can see, we start with imagery, and imagery means visualization, eyes closed. So why not start with a small imagery exercise? I would like you to all just close your eyes for the next 2 or 3 minutes. And take a deep breath. So, does that mean that all the things that we picture then sort of reflect something that happened in real life? So that patients, when they come in and we ask them to close their eyes, does that mean that the things they see with their mind's eye, they actually happened? It's a long text on this slide, but basically it says, coming from one of the leading researchers on memory, it says, don't think that way. Whatever we see with our mind's eye, it's a reconstruction. So even though we picture a memory that we think actually happened, it's not a certainty. It's a reconstruction. And even if you picture an event that literally took place, that does not mean that it actually happened in the same way that we imagine it now. The memory is a tricky thing. That's what they warn us for. So we should be careful. We are using, with imagery, we are using a powerful instrument, but we should be careful to assume that this actually reflects true and actual memories. So when the patient says, I see my parents doing something this or that, I never realized that they'd actually done that, it doesn't mean that they sort of uncovered a memory that was sort of forgotten or repressed. A warning note before we start. Because what we start with is to use this powerful technique where mental images that have a huge emotional impact can be changed. Those mental images, we can sort of rescript them. We can change those images or the outcome of the events that we imagine. And to do that also has an emotional impact. But then it can have a healing emotional impact. And it turned out to be an effective way of treating post-traumatic stress disorder, social anxiety disorder. So it's not just a good story that I'm telling you. Actually, it has proven to be effective in those disorders. It's probably a very good technique in treating depression. And it has promising results in all those other disorders that you see. So we use a technique that is effective, but it also means that I will not give you the message this evening, try it out on everyone and everybody. No, we have to follow the guidelines, and you can use it in treating post-traumatic stress disorder or social anxiety disorder. And with these other disorders, first do your normal therapy. If that doesn't work, this could be added to that, or it could be a second choice. Okay. Now, why is it working so effectively? Because it has been studied. But why? How does that work? Because like with post-traumatic stress disorder, the trauma happened in the past. How is this healed with rescripting that image? That is also room for hypothesis. It's not a certainty. There are two leading hypotheses. The first one is the moment that you start to remember a meaningful event, that memory becomes open to new information. It becomes, how do you call it? It becomes fragile in a way. It's susceptible for new information. So when we rescript, we add new information to that memory. And when that memory is stored back into the brain, it incorporates that new information, the rescripting that we did. But hey, there's also another hypothesis that just states it's a form of counter conditioning. What you do is you create a new memory, so to say, and this is a more positive one, and you make it more accessible. I'm not a researcher, I'm a clinician, so just follow the guidelines that I'm offered. And the guidelines so far, it's effective, you can use it, but we don't know why it's really working. So we don't need to worry about that. What we need to do as clinicians, if we use this technique, we need to activate meaningful memories or generate meaningful images, mental images. And it has to be experienced. So the biggest pitfall that we have is that we start to talk about those mental images while doing the imagery. The guideline should be when you have the eyes closed, then it's all about experiencing. So it's all about what I see right now. What do I hear right now? You have to reflect and you have to talk about all that, but that comes later. With the eyes open, that's the moment to reflect and to talk about what you experienced.